I think that the employer's attitude and SAHO's attitude at the table has been bolstered by the essential services legislation. I think they're bulletproof. They are coming to the table with a high-handed, arrogant kind of approach. Comments like "you're not nurses" would be unheard of before. Collective bargaining used to be an honorable profession among honorable people, and they are using the changes to the Trade Union Act and the essential service legislation they think it's provided them power and diminished our power. And I guess to a large extent it has. Well, there are a number of areas in the collective agreement that protect things like hours of work and protect conditions of employment. Simple locations of the workplace in the collective agreement. The employer has proposed a number of concession demands regarding those things, one being what they call multi-site workplaces.
They want to move members around throughout the health regions rather than deal with the shortages of staff that are there, the chronic understaffing that there are in all of the facilities, be it long-term acute care or home care.
And this could mean tomorrow I show up for work in Yorkton and they send me to Langenburg. And the next day I show up at Langenburg and they tell me at noon I have to go to Kamsack. It's just an absolute unilateral right they have over your working life. And employees could no longer expect to get up in the morning, send the kids off to school, and go to a place to work. They could be working anywhere within the regional health authority at the whim of the employer.
They want to have our members work over an extended time period outside even the Labor Standards Act, over a 12-hour period, and that would probably go back at least 3 collective agreements in CUPE's history.
Their wage proposal package that they tabled on September 22nd is all conditional upon us accepting all of these concessions. All of these concessions are aimed at providing the employer with complete control in the workplace. Complete control over people's lives, not just at that workplace, but control over their lives when they think they can go home and spend an evening with their family. Can you imagine an employee in home care under their new proposal trying to arrange childcare when you don't know what hours you're working today, you don't know what hours you're working tomorrow? With the multi-site, you don't know where you're going today, you don't know where you're going tomorrow. Get childcare for that. It's hard enough for people to find adequate childcare now. They're telling our single parents, our young parents, that your children are secondary. They're third or fourth in your priorities. You follow our commands. We're going to direct your life, not just for 8 hours a day, maybe for 12, and maybe 6 days in a row, not 5. They're asking for all of these things. This work and family balance that was talked about in previous years is out the window. They no longer care. We're sitting across the table from people who probably average between $80,000 and $130,000 a year salaries, who received huge increases. And when you put 9% on $75,000, that's a significant increase. When you put 2% on $18 an hour for our members, it's a little different story. And it's very interesting and very disturbing to us and to our membership that at this point in time the government comes out with wage guidelines that will punish the lowest paid people in the system, but there's no guidelines for out-of-scope people. There doesn't seem to be guidelines for registered nurses. There doesn't seem to be guidelines for MLAs and ministerial assistants and all of those other people that don't have to negotiate their collective agreement. It's just handed to them.